News Talk is online. News Talk Online, a production of Paltalk.com, syndicated by CRN Digital Talk Radio, posted all over the place. Make sure you go to reportergary.com. Go early, go often, like voting in Chicago for news that you may or may not see in the mainstream media. Ellen Ratner, I apologize to you. Yesterday, I was so busy to the very last second before coming to the air, shoveling snow. I forgot that we weren't supposed to go to Washington. We were supposed to go to you, but we got you here today anyways, and we're thankful for that. The Democrats, or a group of Democrats, are gathering to try to save what's left of Obamacare because the Republicans are trying a piecemeal attempt to dismantle it right now. Tell us about the gathering that you are at, Ellen Ratner, from the Talk Radio News Service,
right.
please.
It's actually the health. It's called Health Action 2011, and it's done by a group that has been really working on health care for a number of years, and so they call it a national grassroots meeting, and what they're trying to do is get people all sort of revved up to go to their members and to really talk about what can be done in healthcare, and so that's kind of how it. What can be done, what needs to be done, and the president was here today, and he sort of did, as we call in negotiations, the parade of horribles. What happens if this doesn't work? What is going to happen? And that's really how, if somebody takes away from it, what is going to change?
Well, I spoke to a doctor who's very much involved in the attempts to not only save the Obamacare package, as we shortcuttedly call it, but also to expand on benefits. And he said this: as companies that are providing health care find that the cost of their premiums are rising, what they are doing is cutting back on health benefits to their employees. And he suggests that it'll be people who are employed who will be joining this fight, along with people who now do not have health insurance, because they want benefits restored. And you're going to see, in his opinion, a change in public opinion, a groundswell of support for some kind of really nationalized health care plan. Is that permeating?
Maybe, and that may happen. I just, Gary, you've probably heard me talk about this before, but I am a typical example. I own a small business. I can't get insurance by people as a group because of my pre-existing condition. I lost my eye after Katrina. I pay, this is goodness, I'll send you a copy of my bill. I pay $1,760 a month for health care, for health insurance. I'm 59 years old, so I'm an old bat, but I've got to tell you, it's just, people can't afford it. It costs more for health insurance in the United States of America than it does for me to pay my rent in Washington, D.C. That's not right.
Oh, yeah, I know a guy who likewise is paying just for himself, no family plan, and it's like $700 and I forget how many dollars he told me, and as a result of his circumstances, because he's only working part-time, he can't find full-time employment any longer, and he's of our generation, he's just barely scraping by the skin of his chinny chin chin as a result. And people are always concerned, the opponents to all of this, that the government is going to be making healthcare decisions, and they say we have the greatest healthcare system in the world. I don't know whether that's necessarily true, but I think that the problem is that the funding is such that it's getting out of reach for a lot of people here, and it's not a question of health care reform as much as it is health care funding reform.
Well, yes, and the problem is that doctors, doctors are, I mean, it's a guild. They're making a lot of money, some of them. There are ways that a lot of the physicians are doing things, such as nurse practitioners. We should get more of that. They don't open up enough slots in medical schools in this country. That's why a lot of American students, including our military correspondent, are offshore right now. Because if you're older student or whatever, they're still not opening up enough slots in medical schools, and we don't have enough trained people, and it's a guild issue because so many of the doctors make a lot of money.
But on the other hand, there are those who are struggling as general practitioners because they spend more overhead in processing for the various insurance companies' claims. And I spoke to another doctor the other day who said that he gets on the phone and he spends hours on the phone himself, forget about his staff, sometimes advocating for his patients because he prescribed, as the physician, a medication or a treatment that the insurance company refuses to fund, and he's screaming at these insurance companies and he's saying to them, hey, I'm the doctor, you're not the doctor, I went to medical school, you went to medical school, you cannot practice medicine without a license in the United States of America. And he says he has even threatened insurance companies, Ellen Ratner, either you cover this treatment or medication for my patient or I'm going public. I'm going to the newspapers, I'm going to the radio stations, I'm going to the television stations, and I'm going to say that X insurance company is putting my patient's life in jeopardy and it's got to stop. And then they capitulate because he means it when he says it. But a doctor shouldn't have to call up an insurance company and advocate for treatment that he prescribes for his patient.
Well, that's right. I mean, I think there's a lot of simple fixes that could make a big difference, and the question is whether they're really going to happen or not, and whether there's the political will to make them happen.
And the one thing that really I find disturbing about all of this, Ellen Ratner, and you are in a better position to comment on this than am I, there was a time when there was bipartisan support for some kind of health care reform, and then it became a partisan political issue. Both parties made it a lightning rod, and as a result we have this schism, and we've got people on both sides of the issue scaring the bejeebers out of whoever it is who are listening to them, and as a result it has polarized the nation rather than, I mean, there was a moment there, it was a short moment when there was pretty much agreement that something had to be done, and it could have been done in a bipartisan manner, and that never happened. Is that a fair assessment of what happened up there on Capitol Hill?
Right. Well, I mean, Gary, you really seem to have your pulse on it. I wish you were at this Radio Row because I think you have a very good way of describing what the very hard issues are.
Well, I appreciate that from you because you're far more versed in the issues than am I, and I've learned a lot from you, actually, and from others from the Talk Radio News Service through their reports here, and I'm sure the audience, I hope so, has as well. Ellen, have a great weekend.
Thank you so much.
Thank you, Ellen Ratner, Washington Bureau Chief from the Talk Radio News Service, joining us live from Health Action 2011, a group of proponents, mainly Democrats, of Obamacare who want to not only save it but perhaps expand it.